Thank you for staying with us on Channels Television. Welcome to Health Matters. I'm Yomi Otaigwe. It's not going to fizzle out anytime soon. That's one of the information that we've been told by scientists and health authorities who are working towards the containment of COVID-19. Now, this warning is not to frighten you, but to gear everyone towards enlightenment and taking responsibility in a collective fight against coronavirus. One of the ways to take responsibility is for individuals to consistently take safety cautions against the disease, whether at home or at the workplace. Today on the program, we'll be focusing on preventing COVID-19 at workplaces. Our guest is a public health practitioner who is also the public relations officer of the Society of Occupational and Environmental Health Physicians of Nigeria, Dr. Nsukka Ntia. Thank you so much for being here.
Thank you for having me.
Okay, so let's quickly see what the figures, for Nigeria's COVID-19, what they look like, as at July 24th. So we have a total of 39,539 confirmed cases so far. And out of this, we have 16,559 people discharged. Thankfully, and of course, sadly, we have lost 845 people. So, Doctor, when the first case of COVID-19 landed in late February, it's 5 months after now. Did you ever think that we're going to be close to 40,000 cases?
I thought it would be worse. I frankly thought it would be worse. And here's why. I knew that we were going to slow burn initially. It would grow and there will be a steep rise when we entered full community transmission. And because this hit our most urbane cities, it was going to spiral out of control. I have two opinions around what you've just asked. And the first of them is that it's actually much worse than 40,000, clearly. And I tell you why. Our test to confirmed cases ratio had always been about 20% for a long time. It only dropped to something like 16 or 15.5% recently in the past couple of weeks because of the aggressive testing that's been adopted by the federal government and the NCDC. However, the recommendation is that you should be something around 3 to 10%. So if you have more than that, you're not testing enough, clearly. So we're somewhere like another 10% away from ideal test to confirmed cases to total test ratio. What that tells you is that the amount of people that are infected in population is still much more than your figures say. The second one is that the positive test ratio to total tests, which I referred to earlier, which is today is about 15.4%. Because our model for testing is high risk, so we test those who have symptoms, those who are primary contacts of known cases and things like that. You have to have a reason that's clinical, if you like, for testing. We don't test full blast community testing as yet because of capacity. Then it means that you're only selecting, there's a bias towards those who are likely to be positive. And that's why our ratios are that high.
And then some people are asymptomatic and,
A lot of them. So they move on without it. They have it and they don't even know, thankfully. So, but if you do that ratio on the math, there's a school of thought around how you transform that ratio to the incidence rates in population. And for high-risk models in a society like ours, with very reasonably poor infrastructure for that, then it's something like maybe 20. You come down and divide by 20. It gives something like 0.8 to 0.7% of our population. In Nigeria, that's nearly 2 million people. So it gives you a sense of what we're really dealing with in society. Now, that may still not be 100% lockdown in science because there's a margin for error in that formula. But we are around, in truth, to my mind, somewhere like 800, 900, 1 million people infected in this country.
And what do you think about the national response so far?
Given the fragility of our infrastructure, given our natural challenges with organization and organized response, I think there's been a reasonably good job. I think I commend the NCDC totally for the way they've been very structured in their response in spite of the natural ingrained challenges we have. We are doing this, all of this response against the backdrop of a very fragile health infrastructure. So there is the getting infected, there is the disease phase, there is the severely infected or severely symptomatic folks. we're not set up to deal with something on this scale for this length of time. So given that backdrop, I'm not giving any excuses, but I think that there's been reasonable effort. Can it be better? Oh, certainly. Can more organized response be done? Oh, certainly. But, it could have been much worse. That's a simple truth.
Okay, so we all know that, and from what the scientists have told us, COVID-19 is not going anytime soon, at least not before we find the vaccine and, proper treatment for it. Let's look at COVID-19 and the workplace. How important is it, for us to get it right at that level in terms of prevention?
I'll give you my theory and the reason why we must get it right at that level, and why I disagree with some of the response that's been pervasive, in our society. One of the biggest elements of a societal well-being is productivity. Where there's reasonably good, decent, optimal productivity, there's less crime, there's less stress, there's less rancor, there's less desperation, there's less need to resort to negativity, if you like. So when people are productive, even moral values rise. So it's one big marker of well-being of a society, and that's why we need to focus on it. In Nigeria today, 54% of the population are in the working age group. So 111.1 million people, and that's NBS statistics. So imagine if you made 101 million people productive in spite of the raging pandemic. That's a positive, because the more productive they are, the more they can deal with the pandemic and things like that. And that's why it's crucial that we get the workplace component of the response right and get people back to productivity and even optimizing that productivity.
And this workplaces, of course, different areas, different, if you like, people do, of course, different things.
Absolutely.
The NCDC, rolled out guidelines on how for employers and businesses, to return back to work, at least for some level. So we have for the agriculture, we have for construction, we have for banking and finance, different. Okay, so we have some of them that are similar. So we have for agriculture, you now have the activities that must be carried out at that level. So let's take, for instance, a typical banking hall. Yeah. What precautions do we need to take, at that kind of place?
So with any workplace at all, and I'm going to start with general high-level principles first before we devolve into detail. The first thing that you must always do is assess the workplace. You have to have a very decent, robust risk assessment that's specific to the workplace. And the first principle for that is you assess it geographically. So what is the geographical setup of the workplace? And then you go further to assess what are the activities in that workplace and what is the risk associated with that activity. Then you can layer on the mitigations that you want to play. As with any mitigation in occupational medicine or any preventive kind of science, the first thing is a hierarchy of controls. So first, can I eliminate this activity at all and therefore obviate the need for people to come in close contact with each other? The second one is, can I substitute that activity? Therefore, can I move that activity to some other place that's sort of away from the rest of the people and therefore reduce the need for that interaction? And then when that is not possible, then can I engineer out, if you like, the need for proximity? And that comes with physical distancing, which is moving things apart, and social distancing, which is reducing the activities that bring people together. They're two different things. There's always social distancing, everyone talks about that, but actually it's physical distancing, that's 2 meters, and social distancing means the activities that bring people together. And you must sort of be clear about what that means. And then when you can go further, say, well, that still isn't quite optimal or not possible because people must interact, then you come to protecting people. The masks, for example, gloves if you can, if you need to use them, and then just share, cleaning up after, before and after activities and things like that, depending on your workplace. So in summary, assess the geographical location and then assess the activities and tasks therein and marry your mitigations, to line up with that, and it gives you some degree of some sense. Then you go on and say, if something does still go wrong, how do I deal with that? You must think it through, make a plan, don't wait for it to happen first, and then you go on and test that plan and put it in motion, and then you maybe then have a chance.
So that's for every business owner?
Everything, every business owner, no matter how small.
No matter how small.
Yes.
Because at some point the PTF said, okay, so offices may have to operate at maybe 75% capacity, or depending on, what number of members of staff that, each organization would have. So I mentioned the banking hall the other time, you'll get there, but let's look at even the health sector itself. Let's look at hospitals and health facilities.
Correct.
Because sometimes you would be surprised at the kind of cross-infection that would go on in that area.
Yeah. So the healthcare industry is perhaps the most vulnerable industry in terms of the pandemic, because the healthcare setting in itself aggregates the risk, and therefore it's we call it the extremely high risk geographical location, the hospitals and healthcare settings. And then the tasks therein are also the most high-risk tasks, because you are actually going to intervene to someone who most likely has got the virus. So you're not going to be able to distance yourself. You're going to have to just go on and then maybe follow the last rung of protection, which is protect yourself. Mm-hmm. And then most of the things you do actually generates, some of them, aerosols, and therefore puts you more at risk. So when you look at the healthcare setting, it then therefore means that everything we call around what we call IPC, which is infection prevention and control, has to be top notch. No matter how small your healthcare setting is, you must pay attention to IPC in these times. And some people have gone on and maybe become creative around it. There's also the part where you say, can I reduce the interaction between the healthcare practitioner and the patient, in terms of, if you don't need to come in, then don't come in. Can I consult you via phone? Via video, for example. Can I refill your medication remotely? Therefore, a lot of people are doing it now. Pharmacies, hospitals put a delivery guy, put the medication in there, and they send it to you at home. Can I create other ways to interact with you rather than have to come in? And you come in only if you have to come in, to protect you, the patient, and also the healthcare workers. So it's that kind of dynamic risk assessment that has to happen in every healthcare setting. And it's scalable to whatever level of healthcare setting that you have. And practicable, because most centers are actually adopting some form of it or the other. One last word around this is that in the beginning, there was so much paranoia and fear that a lot of us in the healthcare sort of side of things were practicing what I refer to as defensive medicine. Mm-hmm. So I shut my doors. I don't want to hear anything. Yeah,
because we've heard cases like that.
I'm sorry, just true. It's just, I'm sorry, it was sad, but true. But everybody thought it was going to be a bad pandemic. It would happen quick and go away. So most people took the extreme mitigation sort of pathway, which is shut my doors. I don't want to talk to anyone because I don't want to contract the virus. As we got to grapple with the reality of it and the fact that it's not as bad perhaps as we initially thought, people have begun to adapt and adopt these measures. So thankfully, we're in a place where people are actually focusing on virus, giving care, and bit by bit we'll come to the point where we indeed become the frontline folks, because if we don't do it, who will?
Mm-hmm. Mm-hmm. We'll take a quick break, and when we come back, we'll talk more about some other workplaces and things that we can do. But it will be time for you to join us in the conversation by calling 0805-468-3514 or tweet at Yomi_Otaigbe. We're still talking preventing COVID-19 and at the workplaces. We still have a public health practitioner, Dr. Nsika Ntia, here with us in the studio, but you can join us in the conversation by using the number that is showing on your screen. So I said we're going to talk about the banks because when you go to banks these days, you find a lot of people. Now, the banks are trying to comply with some of the safety protocols, and they lock their gates. And then you find people, milling around the gates, and, everybody, of course, social distancing or physical distancing is not what they're thinking about. Tell us about that.
So, on one hand, I commend the banks for at least taking certain steps, in spite of the fact that they need people to bring in money and deposits and things like that. But on the other hand, I still don't think they've gone far enough. So let's look at the bank as a geographical workplace. It's often a banking hall, and there may be some offices. It's enclosed, there's air conditioning and all that, so there's a rarefied atmosphere, which is top for transmission and things like that. But the thing about it is then, why don't you start first of all by elimination? So the thing that draws people the most to the bank, can I make it possible for them to do these things without having to come into the banking hall? Mm-hmm. So when they try and limit the number of people that go in, there's a number of people outside who are massed together, shoulder to shoulder, waiting for their turn to go in. It obviates the very mitigation you're trying to achieve by people mitigation inside the banking hall, when in your car park, there are hundreds of people huddled together. So for me, the first thing would have been that what's the biggest thing that brings all these people here? Can I make it simple enough for them to achieve without coming into the banking hall. That's number one. And there's some creative things around that. For example, if a guy has to come and do some SIM card or activate account or something like that, can I make that so simple that on any reason basic phone, I can do that myself and educate people enough so that they don't have to come to the hall? If it's cash deposit, for example, we all know that, even abroad, you have cash deposit machines. Just put your cash in there, it will count to show you your figure, and it's deposited in your account. Can I make that possible, for example, that reduces the need for people to come physically into the banking hall? Therefore, only those who need specific, complicated transactions need to come into the banking hall, and therefore reduce the need for that amount of people sort of in the bank. That's number one. So you've eliminated the need for people to be there in the first place. If then people still need to come into that banking hall, can I segregate them? What group of folks need to come in for what? And therefore, if they have similar problems, can I just make a system where I can deal with the problems almost at the same time? So if it's information, for example, who wants to ask about this? And I say, all right, for all of you with this, please, this is what you need to do, or call that number, or that kind of a thing, and get them away in one go. Something like that, and there will still be a residual few, but that number, I think, will be significantly fewer. And then when you go on and achieve that, I've seen GT Bank, for example, sent me an email, because I bank with GT Bank as well, and they talked about the banks that will be open to you on this day is X, Y, Z. And I'm saying, all right, fine, you're closing the shops, but people need to bank. So you're protecting yourselves, but you haven't solved their problem.
And that needs to be fixed.
Absolutely.
Okay. Let's go to the one that I think it's most challenging, because I have been there and I have seen that when you go to the markets, I'm talking about open markets now,
True.
you hardly will find, people, adhering to safety protocols. How can we work around this?
So I think it's first of all naive to think that we can just get the typical market population to adhere to something that requires a behavioral change. And there are two main reasons for that: the sheer number of people, and two, the typical average level of literacy of the folks who will be amassed in that market without any prejudice to them. So, but my thinking about this is the same approach. As a geographical place, the market itself lends itself to huddling. So we need to find ourselves, how do we eliminate that? You can't stop marketing because people must eat and things like that. And we're very almost subsistence-based kind of population. But then, what if we moved our markets to open spaces entirely? What I mean by that, in the time of the holidays or when schools are shut down, and I'm not saying convert schools to markets necessarily, but can we find those kind of places and say, this market, I'm going to move everybody selling vegetable towards this open space and set the stalls apart in such a way that, they sell most of them on tables. Can I set it apart such that if you need to go to this woman, you don't need to be huddling with the next seller? Something like that. Can I make sure that all the guys selling meat move to X section, and I'm here saying that, look, let's find the space. Let's find the space and move them away from the typical structured market that has been built for them because they're poorly built anyway, because it's stall to stall. When I can move them to an open place with open tables. Because remember, open air really helps us with mitigation. That's one of the things that's kind of helping us in Nigeria. Our humidity, our climate, the fact that there's a lot of open air around and we do a lot of things outdoors. So those kind of things, we can use that to help obviate that risk in the marketplace. And then go further to educate them in a language they would understand around masks and things like that, which comes to things around PPE. But again, still following the same principles about assessment, about eliminating, about substituting, about engineering controls, which is how you set up the stalls, about engineering physical distancing, about the activities that bring them together. So no large meetings, for example, that market people tend to have, and things like that. And then maybe segregating the stalls such that if you have to buy, you don't have to then huddle, from two different people who are saying the same thing. I think some kind of creativity around that might help us reduce the risk in the marketplace and not shut them down. Because it's a double whammy. Shut them down, they go somewhere else in the night and people go there and buy, and the same risk will perpetuate itself. So I think that kind of creative thinking, because they must also live, they're part of the economy, a crucial part for that matter, and things like that. So that kind of creativity, that's through and through nuanced thinking, is the kind of thing we need in the context
What
of
about consistent awareness creation or risk communication? Because some people, of course, are still out there and thinking, you know what, I don't know about this. I'm just going to live my life.
It's on every level that must continue and must be continually ramped up and adapted to suit the situation per time. So for the market women, for example, your jingles must be sort of tuned to what they would understand, examples that they would relate with, engaging them almost one-on-one in the market association so that they themselves can actually connect with the message. They may not understand the science of it, but they may understand the risk of it and then comply. And I don't think that compliance with the whip is the way to go, because very often in many states, when you put a law, then you see the task force guys who themselves are not even protecting themselves, going around to seize things and then beat up people. Ridiculous.
Okay, let's be joined by Lucky from Warri. Hello.
Hello, good morning.
Good to have you on the show. Go ahead, please.
I think I need to thank you for this. I think I need to thank you for this enlightenment and most especially what the guest speaker is actually saying. But I think one of the problems is because a lot of customers, they're actually naive. They're actually naive in the sense that most times when you tell them, I think one of the reasons why most people keep going to the bank is because they seem not to fall in line with the recent trend of picking up either any of these e-channel businesses. So because of that, you're going to be seeing a lot of this crowd. So the earlier customers start seeing the need for them to take advantage of alternative channels. For example, a lot of people have been to places whereby you see people, you advise them to pick up their enroll in any of all these online platforms. They will say no, they rather prefer to come to the banks. So the banks are also trying in their own perspective. So I think enlightenment, the public needs to know that it's important they take advantage of these other measures so that to enable them to get involved as the case will be. That's my contribution.
Thank you, Lucky, for that contribution. So let's go to the debate that is also ongoing now about schools. So for teachers, the school premises, the classroom will be his workplace. We're still debating as to whether the children should go back now or not. But if we, or when we have to go back, what do we need to put in place?
Would you allow me to be controversial, to be a bit controversial?
Okay, I'm not sure I'm going to give you that license, but please go ahead.
So first of all, I think we've gone over the top with medication for schools, and I'll explain why. In the early school years, that population is the least at risk for COVID transmission and infection, 0.6% globally. So the population of people sub 10 don't get infected like that. They are also, even when they're infected, they just walk through it. You hardly see them.
But they take it home.
I'm going to explain. It still shows that in that population, they are least likely to transmit. They are usually asymptomatic. They are least likely to transmit. My point is that we are herding away people and taking away the learning that is a crucial part of societal development. A child loses half a year of school.
You know, I told you this is a debate and it will continue.
All right.
But of course, we want the best for the children. We want the best for everybody when it comes to COVID-19. Thank you so much for your time today on the show.
I appreciate it. Thank you for having me.
Thank you for coming. And that's Health Matters for the week. If you or anyone around you is exhibiting COVID-19 symptoms, and you are in Lagos, do not forget to call the toll-free number showing on your screen, and it's going to come up anytime soon. And of course, we also have the NCDC hotline number, which is also available. And if you miss any part of this, you can log on to channelstv.com/podcast for both audio and video versions. Thank you for watching. I am Yomi Otaigbe.